We're here on location at the Arima General Hospital in Trinidad and Tobago. Our doctors, nurses, and healthcare workers all doing a tremendous job. You know, life is bountiful. Its rhythm vibrates within the rivers and very earth you stand upon. Nature and society are intrinsically linked, forged by generations of creation. Mother Earth, Creator, Mother. Women shape the mold for this ever-evolving world. Our mothers, sisters, and daughters are the engineers forging the very breath of life in our lungs. Welcome to this special edition of Caribbean Medical TV. I'm Dr. Mariam Abdul-Richards, and today we focus on women's health, while also exploring the sacred connection of woman to nature, and so much more. This is Caribbean Medical TV.
Welcome to our special presentation of Women's Health on Caribbean Medical TV. Let's hear now from our specialists.
Women are the backbone of our society. We carry a lot of responsibilities, whether it's at home, whether it's at work. We seem to forget about is we put everybody else ahead of us, right? So we take care of our families, we take care of our parents, of our children, of our spouses. When do we put ourselves on that same priority line that we put everybody else? When was the last time you asked yourself, what is it that I need? It's equally important for men to understand that they have a role in this as well. They have an active role in the well-being of the women in their life. Whether it's by making sure that she does her medical checks on time, whether it's by making sure that she eats, that she rests, and that support needs to come from our men as well.
We have a bad issue in terms of women versus men and their attitude towards health and keeping themselves healthy. Men, there's a lot of machismo issues with men that some of them boast they haven't seen a doctor in many years. Women, on the other hand, tend to respond to early signals and seek medical attention much more early in their lifestyle. So women, by and large, seek attention earlier, so that if that were across the board, we to get much more of the problems that we find out late, we can get early. But women tend to do better. They seek help much more readily than men do.
Well, most of what I do is education. I make that one of my biggest things. When it comes on to the pregnancy, we go through every potential, thing that could happen, complications. I prepare them before it happens, so when it happens, they're aware of it. In terms of from a GYN standpoint, I try to educate women as much about their anatomy, about how their body is designed, how it's designed to work. I tell them about the STDs. I tell them about getting their mammograms done based on what the recommendations are. I focus on self-breast exams a lot so they can be aware of what is normal for their body, and if something comes up that's out of the ordinary, then they can come in.
An obstetrician is someone that a patient comes to when they're pregnant to seek care. A gynecologist is someone who sees about problems with the female reproductive tract. Common gynecological problems that women come to see a gynecologist for is for vaginal infection, for contraception, for heavy periods. Some of the causes of heavy periods are fibroids and adenomyosis. So if anybody who has heavy periods, they should come to a gynecologist to check for this. Also, painful periods are one of the common things that women come to see gynecologists for. Bleeding after sexual intercourse is another common thing. Irregular cycles, infertility.
So as a gynecologist, we are responsible for women's health. We talk about hormonal imbalance, cervical cancer, prevention of cervical cancer, ensuring that they do their pap smears. We have menopause, we deal with menopause, and of course all the oncology.
The Ministry of Health in Trinidad and Tobago in the year 2017, we would have formed the Directorate of Women's Health in order to prioritize women's issues. So this was the first time that a ministry in one of the Caribbean regions would have done so. And this was actually an issue that had plagued Trinidad and Tobago for many years, as well as all of the Caribbean nations. One of our priority areas would be the outcomes for our mothers and newborn babies. You would appreciate that this is a priority area because a country is measured on the way we treat our women and especially our mothers and newborn babies. If we invest resources, the best place to put those resources would be at the start of life.
Let's check in on your questions. Question 1. Is there a particular reason you have to go to a gynecologist?
The most common cause of a visit to the gynecologist has to do with infection and or abnormal bleeding. And these are, now when you go there, they also stuff like fibroid uterus or tumors of the uterus. There's cancer, there's cysts of the ovaries, and these are the most common things that we find. All can be, before surgical intervention is recommended, proper preoperative evaluation would mean that they would have screening, they would have the ultrasound to determine if depending on the lady's need or desire for future fertility. So all these things have to be taken into account, and individualization is key.
At that point, what we're screening for is risks. So we want to explain to them, obviously, the menstrual cycle, if mom and dad have not done it already. We also look for eating disorders. We look for exercise. We look for obesity. All of these things are part of the GYN evaluation because these things can affect your menstrual cycle. If you're too overweight, then you'll be having irregular periods. If you're underweight, you may be having irregular periods. So all of this kind of, comes into GYN.
One of the common causes of irregular periods is something called polycystic ovarian syndrome. That is when women have irregular periods, but that is diagnosed with ultrasound and blood investigations. And once we diagnose it, then we treat the patient accordingly to help them regulate their cycle. And it also can cause patients to have problems becoming pregnant. So if we do pick up polycystic ovarian syndrome, we usually educate the patient on regular cycle and for fertility later on in their life.
Thank you, Dr. Bagan. Our next question to Dr. Boxell. Can you speak more on breast and cervical cancer, especially if it runs in the family?
In terms of the Caribbean, the highest rate of GYN pathology is actually breast cancer, but women die the most from cervical. And as a result, that's why the pap smear is so important. Ideally, you're supposed to get it once a year. Something that's also very interesting that a lot of people in the Caribbean are not aware of is that cervical cancer is actually caused by a virus.
HPV, human papilloma virus, is very prominent in the transmission of cancer or the causation of cancer of the cervix. If people take the vaccines early enough, they'll prevent the transmission of this virus. Cancer of the cervix is by and large preventable. And that's what human papillomavirus, HPV, is responsible for. We know that for a fact.
If women do pap smears as recommended, no woman should die or get cervical cancer because we have a screening program for it. We, the healthcare provider, will pick up changes, offer you treatment so that you do not get cervical cancer. So by doing your pap smears regularly, we can then determine what treatment modality you need. And unfortunately for us women, our cervix is not seen, it's hidden. So if we get a cut on our hand and we notice it's getting infected, we go to the doctor. Our cervix is inside, so we don't see it, we don't remember to get your pap smear. So I try to educate my patients, try and do your pap smears on your birth month. It's your gift to yourself. My birthday is in June, I'm going to do my pap smear, I must do my pap smear. This is the only thing I give myself.
Thank you, Dr. Camille Nichols of St. Vincent and the Grenadines. I'm Dr. Mariam Abdul-Richards, and I'm proud to join you on this journey. Follow us on Instagram to see more behind the scenes from today's episode and a sneak preview of upcoming episodes. You're watching Caribbean Medical TV. Stay tuned and we will be right back.
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
Welcome back to our conversation on women's health. We are indeed proud to showcase this critical topic in our Caribbean region. In every home, village and city, the strength of women is evident. We thank you all for shaping these vibrant nations. We return now to the program to follow Dr. Bagan's guide of the uterus as she answers your questions about specific gynecological terms.
Now, this can be confusing for some people who don't understand what I mean, but I have a model here which I can show you. So this is the model of what a uterus looks like. So this is a uterus, these are the ovaries, and these are the fallopian tube. In talking about endometriosis, as I explained, there are 3 layers to the uterus. You have the innermost, which is called the endometrium, the middle layer, and the outer layer. So when the endometrial tissue builds up and there's a backflow of blood, it can become deposited on the outside, and that's called endometriosis. Sometimes it can also deposit on the ovary. When it deposits on the ovary and patient develops a cyst, that's called an endometrioma. This is a module of a fibroid inside of the uterine cavity, and this is an endometrial polyp. And what I was talking about, the adenomyosis, when you get a backflow of the endometrial tissue into the middle layer, this is called adenomyosis. This is a fibroid, and this fibroid here, as I was explaining earlier on, is in the middle layer of the uterus. This is called intramural. When it's inside the endometrial cavity, it's called a submucosal fibroid, and when it's on the outside, it's called a subserosal fibroid.
There are 4 main gynecological cancers. There is cervical cancer, there is endometrial or uterine cancer, ovarian cancer, and vulval cancer, which is cancer that is on the outside, on the vulval area. Out of all of those, cervical cancer is one that we could actually prevent.
In the majority of cases, we actually know the cause of this cancer. It's caused by a virus called the human papilloma virus. And we have a vaccine that is available since the 1990s. It was created worldwide. And in those countries that are using the vaccine, they have seen a dramatic reduction in cervical cancer incidence. These countries include countries like Canada, Australia, in the European regions. In Trinidad and Tobago, we are privileged to have this vaccine available at no extra cost to the public in our healthcare system, to both boys and girls. And that can create lifelong protection, not only against cervical cancer, but also certain cancers of the mouth and throat. And in males, it is penile cancer, cancer of the anus is also reduced by that simple vaccination program. So that's preventative for cervical cancer.
Thank you, Dr. Serju Singh. Our next question involves diabetes prior to and during pregnancy.
Essentially, obesity, which has become a big problem in the Caribbean and across the world actually, what happens is when your weight goes up, your hormone levels change, and when you have hormone changes, then you get an imbalance, because you should not be having like recurrent infections unless something else could be underlying. Actually, very often we are able to diagnose diabetes because you have a patient who just presents with recurrent yeast infections, and then when you go and investigate further, you figure out, oh, she's diabetic, and that's why she's getting these recurrent infections. Once you get her diabetes under control, she no longer has the issues with the yeast infections.
When a childbearing woman delivers a child and they are hypertensive, they are obese, or they are diabetic, they deliver babies that tend to have a relatively reduced kidney mass, whether through premature birth or whether being too large and having relatively small kidneys. And that automatically makes them susceptible to developing kidney disease in their lifetime if they then go on to be obese or have high blood pressure or diabetes. So if we could put in programs to target our women of childbearing age, it can be a novel intervention, something that has not really been practiced widespread at all in the Caribbean, that can reduce future generations in developing kidney disease. Women who have had diabetes, who have hypertension, and are thinking of getting pregnant or are pregnant, it's extremely important to have absolute, meticulous and perfect control of your sugar and your pressure during that time period. It will make a difference.
Thank you, Dr. Emil Mohammed. And now for the next question, which asks about infertility.
Infertility means when a couple has been trying to get pregnant and haven't conceived after 1 year, so they come to a gynecologist for a checkup. Depending on what we find from our investigation, we treat accordingly.
Most of the times in the Caribbean, fertility has been related to the woman. That's how a lot of people perceive infertility to be, when actually 40% of the times it has a male etiology. And so if the woman is not getting pregnant, 40% of the time it's due to the male. It could be they've had infections, or they have a current infection, or they have an hydrocele or something going on in their testicles that may be causing them to have a low sperm count. And if they don't get evaluated, then we are busy working up the female partner, and we're not getting anywhere. There are multiple reasons why women would not get pregnant. It can be anatomic, like the fibroids, the endometriosis, things of that nature, but we don't want to rule out the guys in the infertility discussion at all.
Many thanks, Dr. Boxell. And now we pose another question from one of our viewers, and this pertains to menopause and aging. So let's hear from Dr. Nichols of St. Vincent and the Grenadines.
A lot of women think menopause is just the cessation of your periods at 50, but your body actually starts changing after the age of 35. You have what's called ovarian decline. So your periods begin getting erratic, you have long periods, you're missing your periods. And it's not just your periods, it affects your whole body. It affects your skin, it affects your collagen, it affects your hair, it affects your mood. So your partner starts saying, "Why are you so moody?" Your children start saying, "Mommy, you're getting really, really cranky." The average age for menopause is 51. Now, when your period stops, that doesn't mean the changes don't go on. You still have to think about bone health. We know that estrogen helps with your bone health. And once your estrogen declines at menopause or during the menopausal period, you increase your risk of osteoporosis. Our risk for heart disease is much less than men in the earlier part of our lives. But once we reach menopause, that risk becomes equal to men, because we know that estrogen is cardioprotective. So we have an increased risk of heart disease as we get older.
Things you can do to support yourself during perimenopause and menopause. Prioritize your sleep. Stress management is really, really, really important. You want to get those cortisol levels as low as possible. Prioritize your nutrition. Make sure that you eat enough proteins. Go for walks, and prioritize weight training, making sure again that you build up, you maintain those muscles, and in that sense, you actually protect your bones as well. With all the noise that's surrounding us today, right? And this is the noises that it has ever been, whether between our electronics and mobile phones and WhatsApp messages and podcasts that we're listening to and TV news and phone calls and Zooms. And it can be overwhelming and overpowering. To remind yourself to take 5 minutes, whether it's 5 minutes in the morning when you wake up and you're still in bed, or 5 minutes when you're in the shower, just to listen to yourself, listen to your needs, listen to your body, listen to your soul. Ask yourself again, what is it that I need today? Continuous and consistent reminder to yourself, I need to take care of myself. I need to prioritize my well-being as well.
Thank you, Vered Westall, for your inspiring insights. You are watching Caribbean Medical TV. Stay tuned and we'll be right back.
Social investment has always been an integral part of the Republic Group's DNA. Our Power to Make a Difference program is the primary mechanism through which we achieve this objective.
We recognize the importance of the elderly in all our communities. We are so happy to be able to partner with the home to the tune of $80,000 to be able to add this wing so that the residents can be more comfortable.
The home has residents from around the entire island. When we have corporate sponsors like Republic, who operate here in the community. It sends a message that we hope and pray it would be emulated by other corporate sponsors.
This initiative is one of the many projects that we have undertaken under the Power to Make a Difference program.
This is Caribbean Medical TV, your guide to health and wellness. Food is the fuel that keeps the mind and body in balance. Here in the Caribbean, we are incredibly fortunate to have a rich and abundant source to harvest from. Let's head over to Grenada, where Chef Belinda Bishop shows us how to incorporate nature's purest ingredients into our diets in this special presentation of Flavors of Grenada.
Well, Flavors of Grenada is absolutely everything, Judy. It is art, wine, music, spices, everything that we have in Grenada. It's our culture. We bring the food straight from the sea to the table or from the land to the table. At the Tower Estate, which is in St. Paul's, it's an estate was built in 1913. And what we do here, she has a 6.6 acres, and they grow all different kinds of herbs and fruit and vegetables. So what we do, we harvest the vegetables right here on location, and then we just invite people to join us to do that. And they get to tour the gardens, pick the fruit, pick the vegetables, and they spend time with me cooking it. And then at the end, after we cook together, we break bread together and we sit down and we feast. What we grow, we eat, right? So today we made a whole host of different things that we harvested from the land. We made Creole fish, and we instead of frying it, we pan-seared it. Instead of using heavy oils, we used avocado oil and coconut oil. We picked the herbs from the garden, the shadow benny, we incorporated in our Creole fish today, and that was one of the key herbs that we used. We used a lot of coconut milk because we made callaloo today, and we made cuckoo, both things that need coconut milk. And we showed our guests how we extracted the coconut milk from the coconut.
From the shell. Right. So let me cut it up here. So they use. We need to get a cheese pot. We need to get a cheese pot. We need to get a cheese pot. And they can just squeeze it.
Well, that's what you could do that, or you also could just do it.
Are we making a drink with this?
No, but this is going to go into the cuckoo, and it's going to go into the. So that's what you could do that, or you also could just do.
That was really exciting for them and a lot of fun. And okra, we had okra, which some people really like it and some people might not. But today, everyone loved it. And so we also had that today. So it was a well-rounded meal, and we enjoyed having the time together to do it. We also had an amazing salad. We picked passion fruit right off the vine here, and we made a passion fruit vinaigrette dressing, which was, we put the shadow benny in it also, and it gave it a nice little kick. Carambola that we picked here on the farm, and that's the 5-finger. Some people know it as carambola, 5-finger or star fruit. So we used that in our salad today. So it was a fruit salad with that blue pea flour that we also picked. We used a lot of different flours in our salad as well. So it was a well-rounded, healthy meal, and we really enjoyed making it together.
Thank you, Belinda, for sharing the flavors of Grenada Nutrition in nature is vital to us all, and we are incredibly fortunate to have the gifts of the Caribbean land and sea all around us. Healthy eating goes hand in hand with healthy living and well-being. We look forward to exploring the flavors of the Caribbean even further. You have been watching a special presentation of Caribbean Medical TV. Let's listen to our final roundup of women's health specialists.
We are very privileged in the Caribbean. Across most of the Caribbean countries, the healthcare systems have evolved such that there's a basket of services. And in most of our Caribbean islands, we have a really well-developed healthcare system that you can go to your local healthcare facilities or polyclinics. We do a lot of preventative medicine, and you can get this available. You can do well women checks, healthcare for men as well, and it's available, already covered by your government's resources.
My advice to women always has been and will always be, your health is the most important asset you would ever have in your lifetime. You take good care of it, it in return will pay great dividends in the short, medium, and long term.
It's important for us Caribbean women to look after ourselves. If you think about early in our lives, we are focused on now getting our careers sorted or starting our family. And it is important that we see our healthcare providers. Not everything we can detect early, but for those that we can, your mammogram, then let us do that.
It is important to go and see your doctor on a regular basis and do your pap smears and mammograms. But we're more than our ovaries, we're more than our body parts. And we women are so good at criticizing ourselves and being so harsh with ourselves. Whether it's weight, whether it's how we look, whether it's our hair, whether it's our skin, all of those things. And then of course, what would the neighbors think? What would the mother-in-law think? What would my friends think? We need to understand that we don't have to take all of that responsibility, that we're at the point we don't really need to prove anything to anybody anymore. You're enough as you are. You're perfect as you are, and give yourself that credit. We need to find that ability in ourselves, to believe in ourselves, to appreciate ourselves, to remind ourselves how wonderful we are, how much we have come through, all the challenges that we dealt with, the wonderful children that we brought into this world, the relationships that we have. Learn to appreciate and respect your own self for who you are today.
We do appreciate you taking the time to join us for today's program. We learned a lot. Many thanks to our health and wellness team. Please be sure to follow us on YouTube, Instagram, and Facebook, where we will have more content from today's episode and more. I hope to see you there. I am Dr. Mariam Abdul Richards. See you next time on another episode of Caribbean Medical TV.